On the point that Senator Moran raised, what's going to happen at the department is going to be an increasing reluctance by this committee to appropriate money and give the department flexibility. You know, when we appropriate money for the provider fund, we expect that money to go to the provider fund, not to go to whatever other fund the department thinks it's better spent. So in fact, when we appropriated the second $75 billion to the provider fund, we absolutely prohibited spending that money any other way or some language close to that. And that's all because of the department's actions. The appropriating committee appropriates based on your request and responds to that request in ways we think is appropriate. And you can't just decide to ignore that. On the vaccine, Dr. Kadlec, we specifically did not appropriate to Warp Speed. We appropriated money to the partners, NIH and BARDA. My understanding is that at least $16 billion has come through those agencies for the vaccine up until now. HHS has told us that to have 300 million copies of vaccine available, they need another $20 billion that they don't have in any specifically appropriated line. Do you agree with that number?
Sir, based on the current situation, yes, sir, that seems to be the number.
All right. Dr. Redfield, the plans you expect to get back from the states by November 1 on distribution of the vaccine, do you think you'll be ready shortly after that to announce your final distribution plan for vaccine?
Senator, it's going to be dependent on the Advisory Committee of Immunization Practices, which will make the final recommendation for prioritization. We will.
I think I'm asking another question.
Okay.
Maybe I didn't ask it well. Prioritization, I want to talk about that too, but surely prioritization will not impact how you send this out to the states. Might impact the number they get, but in terms of the protection of the vaccine, the way it's distributed, to be sure that you have a plan to get this in response to all these state plans as soon as possible. Is that your intention?
Yes, sir. Obviously, the issue that I tried to mention earlier is that, and I've said this in our earlier testimony, some people maybe not, it doesn't seem like they see that it's important.
It is important. It's a second issue, but it's really important, and that was my next question. Where are we on the prioritization, and that will be recommended to the states, or will that be a prioritization we expect the states to comply with?
Yeah, it will be in a recommendation of the advisory committee for how this vaccine, whichever ones are approved, are recommended to be used.
And when will that be available?
That will be available after the committee gets to see the data on the particular vaccine. So, but to answer your first question, because I think it was really important, I want to get to it, this plan for distribution is what we are now to get. And what I was trying to say is, I said before this committee, it's as important that we start that plan back in June.
Totally agree.
As manufacturing. And right now, we've leveraged about $600 million, but we do not have the resources to support 64 jurisdictions to get this plan operational. So to me, it's an urgency, you know, that we get that. And we've done this in the past. We have experience in what it's going to take for us to do distribution and monitoring safety and get these vaccines. As I mentioned, we distribute 80 million doses of vaccine a year at CDC. We have an idea. But this is going to take substantial resources, and like I suggested in June, the time is now for us to be able to get those resources out to the state, and we currently don't have those resources.
The best I could tell, there were no resources provided in the HEROES Act in the House, in both the bill we voted on in the Senate and the bigger bill we proposed in the Senate, we had roughly $6 billion for distribution. Is that the right number, or is that close to the right number?
Senator, in my professional opinion, I think you've got that really nailed. I was somewhere between $5.5 and $6 billion is what I think it's going to take to distribute this vaccine.
And you don't have that money right now?
No, sir.
And you need it to distribute the vaccine?
I think it's as urgent as getting these manufacturing facilities up.
Yep. I think I said in July, and you agreed, that if you have the vaccine and don't have either the plan or the resources to distribute it, that's a huge failure on the part of the Congress to provide the resources that we know are going to be necessary. I hope it's part of whatever package we put together this very month to be sure you have the capacity to do that.